Every 2 seconds, someone needs blood, and that transfusion could mean life or death, which makes blood banks and hospitals vital. In a new trend, hospitals are turning to third-party companies to get blood you need. But as CBS 17's Birshel Edmeh investigates, it comes with a cost you might not be aware of.
What makes it critical is, somebody's got to do it, and if not you, then who?
If this sounds like a plea that you've heard before, maybe even a commercial, you probably have.
Give the ultimate gift of 3 lives for just 1 donation.
Because I know what her life would be without blood donations.
Because of blood services, I decided that I would make sure I would be a donor.
The need for blood donations is real. The number of donors has gone down, and fewer than 10% of us donate regularly.
It's absolutely critical for our patients.
Last year, more than 8,000 UNC Rex patients needed blood transfusions, but those donations didn't come from the local hospital as they have for the last 50 years. They're from the Blood Connection, a nonprofit now serving hospitals in North Carolina, South Carolina, and Georgia. For these partnering hospitals, this business has gotten complicated.
One of the keys, obviously, is to have a safe blood supply. The FDA mandates that, and through that process, there's increased testing costs, which have to be accounted for. And as we face the regulatory pressures, cost pressures, it just really becomes a point where it was not sustainable for us to maintain that operation.
Stephen Finch with UNC Rex says the business of blood was no longer cost effective, so hospital administrators shut down their blood bank. Last year, the hospital partnered with the Blood Connection to do the job instead, just like Wake Med and Duke have.
Our primary focus is our local communities that we work with. Blood donations and products to hospitals.
Good morning. Thank you for calling the Blood Connection.
That's the Blood Connection's promise, that the blood you donate locally stays locally within the community.
We know what our hospital partners would typically use in a day, and that orders get sent to them once a day, sometimes twice a day.
So, but again, how do you ensure that it's local?
Because it comes from here. I mean, we collect it here and then it comes back here.
UNC Rex tells me these changes haven't impacted the safety of blood donations or the cost to you, the patient.
In terms of the service is seamless.
But there are costs associated with this service. Collection, testing, processing, storage, and transport means hospitals now pay a service fee to these organizations. Tax records I obtained show the Blood Connection made $45 million in revenue in 2016, and the top 5 administrators make nearly $1 million combined, with the CEO taking home nearly $350,000. I asked the Blood Connection CEO about their hospital contracts.
Very much not an area that I'm comfortable talking about publicly. We try not to talk about that. It's somewhat proprietary.
UNC Rex wouldn't provide the number either, but according to Modern Healthcare, a unit of blood costs about $200.
We transfuse about 10,000 units of blood a year.
I did the math, and that's about $2 million, and doesn't include the cost of transfusions, which can be anywhere from a few $100s to $4,000, according to Global Health Review.
We're very committed to ensuring that our hospital partners get what they need in the way of blood products, and that's really how we always want to approach any relationship with a hospital, is that we're there for them. We take that responsibility very seriously.
A commitment that UNC Rex says is vital to their day-to-day operations. For CBS 17 News, I'm Birshel Edmeh.